Good morning, good afternoon, good evening, everybody. My name is Ali Bazarbachi. I'm a professor of hematology at the American University of Beirut in Lebanon. So, as you know, the main genetic aberrations included in the European LeukemiaNet 2022 for risk classification of acute myeloid leukemia are NPM1, FLT3, CEBP alpha, RUNX1, ASXL1, BCOR, EZH2, RUNX1, SF3B1, SRSF2, and TP53 mutation. And however, most of these are classified within the adverse risk category, but in the context of allogeneic stem cell transplant, the frequency and prognostic value of different gene-gene interaction has not been studied and may differ from that of patient treated with chemotherapy alone. So to address this question, we decided to evaluate through the EBMT database the frequency and impact of different recurrent somatic mutations, either alone or in association, on prediction of relapse and survival in patient receiving allogeneic transplant, regardless of MRD status. So we performed this retrospective registry-based multicenter analysis from the EBMT with the approval of the EBMT Acute Leukemia Working Party, and inclusion criteria where adult patients 18 or above with diagnosis of AML who received a first allogeneic transplant between 2014 and 2019 and with available pre-transplant genetic profile by next generation sequencing or NGS. So overall, we identified 362 allografted AML patients with available pre-transplant NGS. 85% had de novo AML, 15% secondary AML, and median age was 56 years. So when we look to the mutation frequency, surprisingly, the distribution of mutation frequency was different from that of AML at diagnosis. The most frequent mutation in the setting of allotransplant was DNMT3A, encountered in 33% of patients, followed by FLT3 and NPM1, TET2, RUNX1, and BCOR, all above 20%. Then we had between 10 and 20% by decreasing order of frequency, NRAS, WT1, ASXL1, IDH2, STAG2, SRSF2, IDH1, TP53, KRAS, and CEBP alpha. And then we looked to, we used the multiple correspondence analysis to see association of mutation, and we included 179 patients with simultaneous testing of FLT3, NPM1, IDH1, IDH2, RUNX1, DNMT3A, ASXL1, TET2, SRSF2, SF3B1, and NRAS. And actually, we were able to identify two independent groups of co-occurring mutation. The group one included patients, AML patient with DNMT3A, NPM1, and FLT3 mutation, and group two were patient with ASXL1, SRSF2, and RUNX1. And then we performed an outcome analysis on 145 patients allografted in CR1 with available data for these two groups identified by the multiple correspondence analysis, namely the 6 mutation ASXL1, RUNX1, SRSF2, NPM1, FLT3, and DNMT3A. And by in univariate analysis, only NPM1 mutation predicted post-transplant outcome with positive impact on 2-year leukemia-free survival and overall survival. The other mutations had no impact when we take them as in univariate analysis as isolated mutation. But then when we analyze the outcome by group of mutation, patients with NPM1 mutation, regardless of the other, had the best outcome with a 2-year leukemia-free survival of 72%, 2-year overall survival of 81%. Then we had an intermediate outcome for patient with FLT3 and or the NMT3A in the absence of NPM1, regardless of the other, with a 2-year leukemia-free survival of 48%, and a 2-year overall survival of 63%. Then for patient with wild-type NPM1, FLT3, and the NMT3, but who had one of these three at least, ASXL1, RUNX1, or SRSF2, they had a very good outcome, 69% 2-year leukemia-free and 2-year overall survival of 77%. And finally, the worst outcome was for patient with all 6 mutations negative, with a 2-year leukemia-free survival of 49% and 2-year overall survival of 57%. So in conclusion of this study, NGS at diagnosis can be extremely helpful and useful in risk stratification of AML patient undergoing allogeneic transplant, potentially allowing adequate post-transplant interventions. And we were able to identify 2 independent groups of co-occurring mutation. The group 1 included the NMT3, NPM1, and FLT3, and the group 2 included ASXL1, SRSF2, and RUNX1. And when mutations were investigated in groups, the 2-year leukemia-free survival were highest with NPM1 mutation, regardless of other co-mutation, followed by RUNX1 and or ASXL1 or SRSF2 with a 2-year overall survival of 77%. And I remind you that these were classified as poor prognosis in the ELN 2022 at diagnosis, but they appear to be of good prognosis in the setting of allogeneic transplant. The worst outcome was for the 6 genes unmutated. Thank you for your attention.